Fox Carolina is committed to you, and we are following some big news tonight. Johnson & Johnson asked the FDA to authorize its booster shots for millions of Americans. This comes on the heels of Pfizer boosters getting authorized last month, although those were only for older and at-risk people. Now, if authorized, the J&J booster would be available for anybody 18 and older who previously received the company's single-dose vaccine. Fox Carolina's Matt Koufax spoke with some doctors to ask about who should get these booster shots and how soon they might be available. He joins us live at our station tonight with the story.
Tori, doctors tell me you might be able to get a J&J booster sooner than you might think, which they say could be needed as we get into the winter months and the potential for increased COVID transmission. Dr. Christian Montagano with Emergency MD Cherrydale says they hope to be administering J&J boosters ASAP.
I would hope within the next couple weeks, definitely before Christmas.
Johnson & Johnson announcing today that new data shows a booster after about 2 months can provide up to 94% protection against severe illness from COVID-19. Montagano says most data shows immunity levels from initial COVID vaccines can drop after about 6 months.
That booster would be critical to boost your immunity, especially that people are susceptible, to this kind of illness.
He adds the timing of this couldn't be better, with COVID cases finally dropping after hitting what the doctor says were peak levels just 2 or 3 weeks ago.
They've definitely dropped. At the peak, we were seeing about 50 positives out of the 100. So we had about a 50% positive rate.
Booster shots have been, coming into the conversation, especially for people who are a bit older.
Neighbors like Carly Madej say they're still being cautious, but have had an easier time living their lives this year.
I really have full control over, who I decide to interact with and when, and what's my comfort level with doing so.
She thinks boosters could be a valuable tool, especially with colder weather months and potential indoor gatherings on the horizon.
If they're comfortable doing that, then I think it's definitely a good way to try to keep everyone safe this holiday season.
The risks of getting COVID, I think, far outweigh the risks of you having a reaction or a side effect to the vaccine.
So what if you didn't get J&J? Well, as of now, U.S. officials don't recommend mixing and matching different vaccine brands, but Pfizer's already been approved, and the FDA is also gathering a panel of advisors next week to review Moderna boosters. So there could be options on the table for whoever wants one of these in the near future, no matter what vaccine you initially received. Cody, Tori.